Hello everyone, Caroline here, and today we're going to keep talking about our factors in medicine. And we're going to look at one that crops up every so often. It's the factor of warfare. So, wars are obviously not going on continually throughout each time period, but there are some major wars in each time period that really do move medicine along. So, just a reminder, we're looking at seven factors. So, seven reasons why medicine either improves or medicine gets held back. So, religion and superstition, communication, warfare that we're doing today, science and technology, chance or luck, the role of the government, and then the role of individuals. So, across all of the time periods, there's some things that warfare does in common. And a big one is it improves the skill of surgeons. So, a lot of medicine in warfare is surgery. So, it's men that have been shot, men that have had shrapnel wounds, especially arms and legs. So it's the surgeons they need more than a doctor. And it really does help surgeons develop new techniques, find ways around the problems. So it encourages improvements across all areas of medicine, but in particular surgery. And in particular, the three big issues with surgery. So, if you remember the three problems that surgeons really face, so pain, how you stop people feeling pain, or how you make sure that your surgeries are done quickly enough that you put them out of their misery before too long. So what that means is in-depth surgery, long surgery can't take place because of the pain to the patient. Infection, which is going to be a huge issue all the way up till we discover germs, and blood loss, which is going to be a problem only really properly solved in the modern period. So first up, we're going back to the Renaissance. So we've got work of surgeons going on like Paré, but apart from surgery, there is just one example that we're going to look at, and that's Harvey. So, William Harvey, you might remember, discovers that the heart acts as a pump. And as he's working, in the background, the English Civil War is going on. And Harvey very famously goes onto the battlefields. So he spends time on the side of the battlefield, and what he's doing is looking at injuries as they happen and learning from them. In particular, blood. So he's looking at people that have lost arms, lost legs, looking at the blood that's kind of coming out of them, and from it drawing his conclusions about the heart. So, yes, we've got advances in surgery, but there's the odd example where medicine's being improved, like Harvey in the industrial period there. So we've got the Crimean War. So the war between Turkey and Russia, Britain come in on Turkey's side, and they end up fighting mainly on the Crimean Peninsula. So during the Crimean War, they've got injured soldiers are taken back to the hospital at Scutari in Constantinople, and there you're going to find Florence Nightingale. So she does a lot of her pioneering work there on the importance of cleanliness and about how to set up a good hospital, how to set up training of nurses. So the Crimean War helps out Nightingale and it helps improve hospitals. Still in the industrial period, we've got the Franco-Prussian War. So Prussia is an area of what is now Germany. So it's before Germany as a country unifies, you get Prussia, and Prussia goes to war with France right at the same time that Pasteur and Koch are competing for germ theory. So Pasteur comes up with the theory of germs. Pasteur is from France. Robert Koch is a Prussian doctor and he's trying to prove it. So he's trying to prove that germs make people sick. So they're competing. And at first, it's quite a friendly competition. But then with the war, it really drives that competition on. And it encourages the governments of those countries to get involved, to start funding more, to encouraging their person to win. Another thing to note is the Boer War. Now, this happens right at the end of the industrial period. So this is a war in what is South Africa. So Britain goes to fight the Boers in South Africa, and they call out for volunteers. They don't have enough soldiers. A third of the volunteers, though, have to be rejected because of poor health. And so what this does, it flags up how poor public health is in a way that the government cannot ignore. So 1 in 3 of the people who volunteered, they had to say thank you very much, but no thank you because you are just so ill and in such bad health, we can't actually send you out there. So makes the government really sit up and notice and go, we've got to do something with public health. So then into the modern period. So the modern period, time of warfare, in particular World War I, World War II, and that's going to do a lot to drive on medicine. So first up, blood transfusions, and you can see on the picture there on the right, they had blood transfusions before World War I. So Landsteiner discovered the blood group, so they knew that you had to match the blood. So that solved a lot of the issues with transfusions. But what they can't do is store blood. So, as you know, when blood leaves the body, it starts to clot. So, they were doing the kind of transfusions that you see in the picture. So, they're called donor to recipient transfusions. So, you can see the patient's the lady, she's lying on the bed. The man donating blood is sat there right next to her, and you can see the doctor's got a tube. So, the tube's going from his arm into her arm. Even with that technique, doctors reported that blood would coagulate and clot in the tubes, and sometimes the tubes would block. So it's a great way of doing a transfusion if you've got a patient that needs it and you've got someone who can donate right next to them. What World War I does is give them huge numbers of patients that all need blood transfusions. You can't possibly have a donor just like lined up waiting. So it prompts them to find ways to store blood, which they do. They manage to set up a blood bank. So they add chemicals into the blood to stop it clotting. So kind of like today, that's like the early stages of our blood banks where people might go and donate blood and they'll be stored for months before they're used. Also big on prosthetics, so artificial limbs. So they are around before the war, but the technology really moves on just because of the sheer amount of young men that are missing arms, missing legs. So a lot of work on prosthetics, developing really good prosthetics in this time period. And also you've got the work of Gillies, Harold Gillies, who does an awful lot with plastic surgery. So a lot of the young men have facial injuries from shrapnel, so damage their faces. Gillies does a lot of work in pioneering new techniques, that some of which the basis of what's used today. So trying to give as normal an appearance as possible. And if you get to, I mean, look at his pictures, some of them are quite upsetting to see, so just be careful if you're going to Google him. But you can see just the sheer success that Gilly had in creating normal appearances. And then World War II, so the big one, penicillin. So in World War I, the biggest cause of death amongst soldiers was infection. So World War II, they're aware of that. There's a real drive by British governments, but also by the American government to get penicillin. It's been discovered, but they need to get it to the point that it can be made in the amounts that they actually need. And then World War II has a massive impact afterwards in the setting up of the NHS. So Beveridge is asked to make a report on what the conditions are. I put there children that are evacuated. So children from inner cities, places likely to be bombed, are evacuated to the countryside. And the people in the countryside are really shocked at the health of these children. And lots of reports saying you could tell just from looking at them which children had grown up in the country, which had grown in the city. And the children in the city were much shorter, they were much paler, they were much thinner, they just didn't have the health. And there's also a feeling of the country deserves it. The country has just gone through World War II. Nobody was left unaffected. So the people really have earned free healthcare. So we get the NHS being set up. So, in overview, big driver for surgery all the way through the time period. Less important for medicine, but not unimportant. In particular, World War II has a big impact. And what it does, it kind of lies sleeping, not doing much because there aren't wars going on. And then a war will happen and it will cause these sort of really short, intense bursts of improvement where everyone's focused on fixing this problem because it's an issue for the war. And then as the war dies away, that sort of impetus to get moving goes until you get the next war, and then they're trying to improve again. So it's a really interesting factor. So it's either sort of sleeping, not doing much, or it really is driving medicine onwards.